Hello everyone. Hi, my name is Anuradha, and today I'll be presenting on the unit Health Variation 3 regarding a patient named Maddie Cox. She's 11 years old girl who has been going under treatment for acute lymphoblastic leukemia. During that treatment, undergoing that treatment, she had sudden clinical manifestations which deteriorated her condition. She been found that she's lethargic, weak. She has she's afebrile, she's hypertension, she's got oliguria, tachycardia, tachypnea, confusion, and her skin integrity is pale, warm, ecchymosis on extremities and buttocks. And her blood lesion shows that she's been diagnosed with neutropenic sepsis in a red zone criteria with a Met-Col and IV antibiotics running and even under observation as well. So when we see what neutrophil is all about, neutrophil is the white blood cells that fight infection. So so the low neutrophil in the blood is a kind of is neutropenic sepsis, which is quite sepsis is a life-threatening condition. So in which the body's response to an infection damages its own tissues and organs. So when we look into the pathophysiology, the hypertension and the high pulse rate, which Maddie has had, it's a state of hyperdynamic state. So in that state, there is like escalation in the cardiac output and drop in peripheral resistance to counterbalance the heart rate due to the damage of circulatory volume by raising cardiac output. So the release of cytokines and the pro-inflammatory substances interacts with the endothelial tissues, the cells, causing damage to the endothelium. In addition to the prolonged cell death, it's called the coagulation features, in which it goes to like the vasodilation, capillary leakage, and blood clotting, and causes swelling and tissue edema in the lungs. And that's the reason why there's shortness of breath as well, and causes bleeding due to the excess coagulation proteins, which it's like an overwork. So the further that the cytokines triggers blood vessels to dilate, that causes an hypertension. That's the reason why she has hypertension. So it's called a sepsis-induced hypertension as well. So that's one of the clinical manifestation we focus at, because hypertension is generally a late sign, as in many readings as well as says it's the late sign of septic shock in children. And if we don't want Maddie to have septic shock, because septic shock is a very dangerous stage, because the patient would go to moods that's called the multi-organ system dysfunction. So that's what we don't want her to go, as that's what the sepsis step is all about: the sepsis, severe sepsis, and the septic shock. So looking into one of the nursing priority, because Maddie has got, I focus on the hypertension. So for hypertension, I wished the nursing priority would be fluid resuscitation. Fluid resuscitation would be IV fluid that has to be administered as a bolus. That's sodium chloride that equals to 20 ml per kilogram bolus concentrated in 5 minutes. In some hospitals criteria, they say even within 15 minutes as well, with a second nurse administering it. And it could be further repeated if the arterial blood pressure does not goes to the range. This is of greater than 65, and if the blood pressure is pretty still low, and that should be done in the initial first hour to decrease the sepsis stimulated hypertension. And the initial first hour is what is known as the crucial time of management of sepsis. So now looking into the set of principles being assigned in order to clearly observe the sepsis pathway is the first we need to recognize and then resuscitate and refer. That's called the sepsis pathway. That's called sepsis skills. So in that, looking into Maddie's condition, the resuscitation goal is to have a mean arterial of greater than 65. So if it doesn't work, then the use of vasopressors can be done to optimize the venous oxygen saturation and preload, and even lower her serum lactate level, because if it could be higher than 4 mmol, we need to lower it. And the Perth's Child Hospital says that the inotropes can be used, but this inotropes can only be used with referring to a pediatric consultant, and in her case, the oncology department with the present team who needs to refer it and properly say whether it can be used or not for in her case. So that's all about Maddie, and thank you all for listening, and have a sepsis awareness month this September. Stay safe and be healthy. Thank you.